All right, everyone, welcome back. Getting informed about sexual health is just so important, but it can be kind of hard, with all the information and misinformation
Oh,
out
it
there.
really can be overwhelming.
Yeah, totally. And, that's why we're here today for a deep dive into the world of STIs.
Right. We're going to break it all down for you.
Exactly, 5 common STIs. We'll cover what causes them, how they spread, what to look out for, and most importantly, what you can do about it.
And we really want to emphasize that knowledge is power.
Oh,
Right.
absolutely.
Yeah,
The more you know, the better you can take care of yourself and your partners, right?
exactly.
So before we get into the nitty-gritty of each STI, can you give us like a quick overview of what we're dealing with here? Like what actually causes these infections?
Yeah, absolutely. So think of it this way. STIs are caused by these tiny invaders, right? And there's four main types: bacteria, viruses, fungi, and even these tiny little critters called ectoparasites.
Ecto what?
Ectoparasites.
Wow.
They're like little bugs.
Okay, got it.
But yeah, knowing like what category an STI falls into really helps us understand how it spreads, how it behaves, and how to treat it.
Okay, that makes total sense. So let's kick things off with an STI that I think most people have heard of, but maybe don't totally get.
Chlamydia.
Yeah, chlamydia. That's a bacterial infection. And it's super common, actually. It's the most common bacterial STI in the U.S.
Really? I had no idea.
Yeah, and you know what's wild? A lot of people don't even know they have it.
Wait, really? Why is that?
Well, because a lot of times there aren't any symptoms, especially for women. Like 75% of women with chlamydia don't show any symptoms at all.
Wow, that's a lot. So someone could have it and spread it without even realizing.
Exactly. And that's why it's so important to get tested regularly,
Yeah.
even if you feel totally fine.
Okay, noted. Regular testing.
Yep. And the good news is if you do have it, it's easily treated.
Oh,
Yeah,
antibiotics usually knock it right out.
that's good to hear.
Hmm.
But what if you don't catch it? What happens then?
Well, that's when things can get a little more serious, especially for women. Untreated chlamydia can lead to something called pelvic inflammatory disease, and that can cause infertility.
Oh, wow. Okay. So definitely worth getting tested for then. All right, let's move on to something I've always been a little curious about. Pubic lice.
Ah, yes. Also known as crabs.
Yeah, crabs.
Uh,
Okay, so I gotta admit, I've heard some pretty wild things about how they spread. Like, can you actually get them from a toilet seat?
Okay, so that one is a myth. You can't get pubic lice from a toilet seat.
Okay, good to know.
But it is usually spread through sexual contact. That's the most common way.
Right, makes sense.
But there's something else that might surprise you about how they spread.
Oh, I'm all ears.
They can also spread through contact with like infested bedding or towels or even clothing.
Wait, really? So, like, if someone uses my towel at the gym, they could get crabs?
Theoretically, yes. Although it's less common than transmission through sexual contact. It is possible.
Okay, that's good to know. So, I guess be careful about sharing your towels.
Exactly. And on the bright side, if you do happen to get pubic lice, it's
Oh,
treatable.
good.
Yeah. There are over-the-counter medications that are really effective.
Awesome. All right, now for a topic that I think a lot of people feel a little uncomfortable talking about,
Hmm.
herpes.
Right, herpes. So herpes is caused by a virus, the herpes simplex virus, actually. And there are two main types. HSV1, which usually causes oral herpes, like cold sores.
Yeah, I've definitely had my fair share of cold sores.
Right, and then there's HSV2, which is usually associated with genital herpes.
Got it. So one's for the mouth and one's for,
Right, exactly. But here's the thing. Both types can actually be found in both locations.
really. So you could get genital herpes from someone with a cold sore.
Yeah, it's less common, but it is possible, especially through oral sex.
Okay, that's something I definitely didn't know.
Yeah, and what's important to remember is that herpes is incredibly common. In fact, most adults in the US have HSV1, like way more than half.
Seriously? Wow. I had no idea it was that widespread. So why is there still so much, like, stigma around it?
That's a great question. I think a lot of it comes from misinformation and just a lack of open conversation about it.
Yeah, that's true.
And it's important to remember that having herpes doesn't define you.
Absolutely.
And while there's no cure, there are antiviral medications that can really help manage outbreaks and reduce the risk of transmission.
Oh, that's good. Okay, let's move on to another virus that I know is really common. HPV, human papillomavirus.
Hmm.
So I've heard that there are tons of different types of HPV, like hundreds. Is that true?
That's right. There are over 100 types of HPV, and most people will be infected with at least one type at some point in their lives.
Whoa, okay, so if it's that common, why should we be concerned about it?
Well, most HPV infections actually clear up on their own without causing any problems. Your body just fights it off.
Okay.
But some types of HPV can lead to genital warts. And more seriously, some can cause certain types of cancer, including cervical cancer.
Oh, okay. So how can people protect themselves?
The good news is that we now have a vaccine that's very effective against the types of HPV that cause the most problem.
Oh, that's amazing.
It is. And regular cervical cancer screening is also really important, especially for women.
Okay, good to know.
Yeah.
All right, last but definitely not least, we got to talk about HIV. And I think everyone knows HIV is serious, but I'm curious about how the treatment has changed over the years.
Yeah, it's true that HIV, or the human immunodeficiency virus, it is a serious virus that attacks the immune system.
Right.
And if left untreated, it can lead to AIDS, which basically makes your body vulnerable to all sorts of other infections.
Okay, that makes sense. But what about treatment?
Well, the advancements in treatment have been amazing.
Really?
Yeah, we've come a long way. Today we have something called antiretroviral therapy, or ART.
Arctic. Okay.
And it's a combination of medications that stop the virus from replicating, basically. It's really effective at controlling the virus and preventing it from progressing to AIDS.
That's incredible. So people living with HIV can live normal lives now.
Exactly. They can live long, healthy lives if they take the RT as prescribed. And they have a very low risk of transmitting the virus, too.
Wow, that's amazing. So early diagnosis and treatment are super important then, huh?
Absolutely. The sooner someone starts RT, the better their chances of staying healthy.
Got it. Wow, we've covered a lot of ground today. It's really amazing how much progress has been made in both preventing and treating STIs.
I know. It's truly remarkable. But it all starts with knowledge.
Yes, and open communication. So here's something for everyone to think about. Knowing all of this, how can you advocate for your own sexual health?
That's the question.
And how can you encourage those honest, sometimes difficult conversations with your partners? It's something we all need to be talking about more.
Couldn't agree more.
All right, that's all the time we have for today's deep dive, everyone. Thanks for listening.
See you next time.
Bye.
Bye.